opportunity to do a mega center was actually deeply attractive at the moment it was offered to me. Attractive to deal with the kind of situation like this. I'm sure you've had today a lot of exposure to the direness that the medical sector typically in terms of shapes and forms, smells and color represents. A world frightening because we all know that eventually we'll have to engage it. And maybe that it will be our last world, but still never in a way comfortable with confronting. So the mega center needed to be here in Glasgow, needed to be here somewhere in this complex. And the complex typically looks like a dire accumulation of medical institutions, architectures, where in a way you can really see the history of architecture reflected, or the history of our culture. The old hospital, still a public building, as Michael Hopkins was kind of suggesting. Then the mechanistic, kind of modernistic element. Then here you begin to see some doubts, and here a full expression of doubt. So a horrendous cycle of diminishing confidence and plausibility. So where to put the building? We looked around, and although this is not necessarily an impressive location, there was some vegetation left on the site, and that became kind of really an attractive, relatively speaking, of course, a attractive kind of idea and location. We explored it. We saw that it was slightly higher so that it looked over this ocean of doubt without being directly confronted with it. And we even thought that there were some kind of relatively romantic kind of sections and delicate sections available, typically Scottish, of course, so therefore a kind of unexpected couleur locale. And that became then the first decision that we should try to exist there. And of course, the difficulty of architecture is to exist on a site without destroying the qualities of that site that attracted you in the first place. This is what we had to build, the typical Maggie Center living room-like conditions, kitchen as a kind of core of the house, offices of course, and then more or less private consultation rooms. Nothing new there. And this is the tradition in which we had to join, the tradition we had to join. All the architectures, kind of relatively shapes, of course, between the rectangular and the kind of rounded, simply the kind of horrendous moment that an architecture has to make a commitment to shape and to make a commitment to what comes next in this chain. So as we said, we wanted to surround or capture this area. This is also how horribly weak and slightly absurd most architect operations begin. A vague idea that there we would be capturing nature, and a vague idea that we would try to create a series of houses that were kind of interlocking without ever creating the kind of claustrophobia of a typical house. So this was the idea, a kind of ring, a ring that would capture that thing here, this kind of vague idea in the site that was there, how we would kind of organize the elements, and how the many permutations that we needed to investigate to make it work. To make it work not only programmatically, but also to avoid ugly views, to avoid unpleasant associations, and so that it was kind of really a very, very, very precise work of both embrace and avoidance at the same time in this context. The main other device, apart from the courtyard, are L-shaped fragments of houses or fragments of room, never the entire room, but always a room-like condition that we thought would be interesting because, of course, Maggie centers are typically unified in their atmosphere. They're typically optimistic, typically colorful. What we felt is that we could do by this single device is vary the mood and the condition extensively. We needed to be really sure of whether passages like this would be anxious or generous, or whether a condition from openness to relative enclosure would not put pressure. So we were whether this kind of extension to create privacies would become too busy or not. So in the end, this is how the thing works. You know, a distribution of living rooms, then kind of more private entities. The open plan section that connects all those private sections, then kind of offers that in a quite natural way, has some kind of overview of everything, the final distribution of the program, the way it looks, and I'm sorry I cannot show it to you here, but simply the way each of these elements could have a different atmosphere to create within the house a great degree of variety. The house, the roof, and what was very great is that we were in a position to test the thing kind of with wheelchairs and all on the roof of a parking lot in our own office, so that we could be sure of our and you know, I've never been so scared to make mistakes as in this case, and so it was a great relief when we could do that. Basically, the idea was, of course, that we embrace nature. An architect always does that in a kind of relatively naive way. Nature is trees, but it was not only the trees, but also the section of the terrain, which offered us a number of kind of relatively subtle varieties. So certain parts are flat and then certain parts are sloped or stepped. Here, the kind of object in itself, how these kind of small varieties of height create intricacy on the inside, the views, the mixture of openness, exposure of history, the thing itself, the courtyard, the two worlds. And as I said, we needed the relationship of an architect and nature is always naive. We needed to work with a landscape architect, clearly two different generations, but a very wonderful collaboration with Lily Jenks that enabled us to aim even more precisely for the views, the coverage, the closure, and the play of the courtyard with the different angles that the interior of the house allowed. And so here, kind of finally, the shape in the tradition of the mega centers. Thank you very much.